Okay, we're back with some more MCQs. This time we have 4 MCQs looking at IBS from osmosis.org. Thanks very much. So let's go ahead and start. A 22-year-old male comes to the office because of constipation for the past 7 months. He says he has crampy lower abdominal pain that improves upon defecation. His baseline is defecating twice per week. He has sporadic episodes of multiple stools per day that last 2 to 3 days. He denies nausea, vomiting, or bloody stools. The abdomen is soft and non-tender. Bowel sounds are normal. A colonoscopy and intestinal biopsy are performed. Which of the following would most likely be seen on light microscopy? A. Mucosal and submucosal inflammation. B. Non-caseating granulomas. C. Normal intestinal mucosa. D. PAS positive macrophages. Or E. Villus flattening. And the answer is, that's right, you guessed it. Normal intestinal mucosa. So IBS is a functional disorder characterized by abdominal pain that improves with defecation, change in frequency of stool, and change in appearance of stool. Physical examination and laboratory studies all are normal. Treatment consists of symptomatic improvement and dietary modification. Hold on a second. I had more MCQs for you, but I lost them. Let me see if I can find them. Oh, I see what happened. Okay, here's another one. A 15-year-old girl is brought to the office because she's been having intermittent diarrhea with associated abdominal pain for the past year. Occasionally, the abdominal pain improves after she has a bowel movement. She experiences frequent stomach aches that occur without warning and has tried to avoid various foods including milk, meats, grains, and caffeine, with only moderate and inconsistent improvements in symptoms. She was diagnosed with obsessive-compulsive disorder 3 years ago, which is now managed with 100 milligrams of sertraline daily. She denies vomiting, fever, hematochezia, and melena. If you forgot what those are, melena is a passage of black tarry stools. Hematochezia is the passage of fresh blood per anus, usually in or with stools. So there is no family history of gastrointestinal disorders, and she is currently in the 60th percentile for weight given her height and age. Physical examination shows no abnormalities. A barium contrast enema shows no abnormalities. Which of the following is the most likely diagnosis? A. Ascaris. B. Crohn's disease. C. IBS. D. Adverse effect of sertraline. Or E. Ulcerative colitis. And we know the answer is IBS. IBS is characterized by having recurrent abdominal pain with associated diarrhea and or constipation. The underlying cause of IBS is unclear, but there is an association with anxiety disorders, and typically there is an absence of pathological findings. Let's talk a little bit more about this. IBS is diagnosed in patients who lack the following alarm symptoms: rectal bleeding, nocturnal, progressive abdominal pain, weight loss, laboratory abnormalities. IBS can be classified into diarrhea predominant, constipation predominant, or mixed subtypes. The Rome 4 criteria defines IBS as recurrent abdominal pain or discomfort for the last 6 months, with at least 1 day per week for the past 3 months, which is associated with at least 2 of the following: 1. Pain related to defecation. 2. Change in frequency of bowel movements. 3. Change in stool form. The pathophysiology of IBS is unclear. However, one proposed cause suggests that it results from a hypersensitive enteric nervous system. Anxiety disorders are present in up to 85% of pediatric patients with IBS. Treatment of IBS includes dietary modifications to limit fermentable carbohydrates and medications to control bowel-related symptoms. Do you remember the song? That dates me, I know, but I don't care. Okay, next question. I think we already did this one. Okay. A 24-year-old woman comes to the office because of intermittent diarrhea and crampy abdominal pain over the past year. During these episodes, she notices an increased frequency of bowel movements and softer stool consistency. Her symptoms get worse with stress and improve when she takes loperamide. The abdominal pain is decreased after defecation. She denies bleeding, weight loss, early satiety, family history of colon cancer and smoking, esophagoduodenoscopy and colonoscopy with biopsy unremarkable. Which of the following is most likely diagnosis? We know that it is IBS. So remember that abdominal pain at least once a week associated with at least two of the following, lasting for at 6 months. This is part of the Rome 4 criteria. Associated with defecation, associated with a change in stool frequency, associated with a change in stool consistency. Anyway, that was a lot about IBS. Thanks for tuning in. For joining me in Med School Radio in Tokyo. We'll have more MCQs in the next systems. Well, actually, I'm in the GI system at the moment, but there'll be some more. You can count on it. Thanks for tuning in. You're listening to Med School Radio, bringing you the best in medicine.